Hello, and welcome to Conversations from the World of Allergy, a podcast produced by the American Academy of Allergy, Asthma, and Immunology. I'm your host, Dave Stukas. I'm a board-certified allergist and immunologist and serve as a social media medical editor for the Academy. Our podcast series will use different formats to interview thought leaders from the world of allergy and immunology. This podcast is not intended to provide any individual medical advice to our listeners. We do hope that our conversations provide evidence-based information. Any questions pertaining to one's own health should always be discussed with their personal physician. The Find an Allergist search engine on the Academy website is a useful tool to locate a listing of board-certified allergists in your area. Finally, use of this audio program is subject to the American Academy of Allergy, Asthma, and Immunology Terms of Use Agreement, which you can find at www.AAAAI.org. Today's edition of our Conversations from the World of Allergy podcast series is targeted towards practicing allergists and medical professionals, and I'm hopeful this is going to provide a lot of great insight into the world of quality improvement. And today's guest is Dr. Kristin Sokol. Dr. Sokol treats patients in her practice named Schreiber Allergy, which is located in Rockville, Maryland. Dr. Sokol has been extensively involved within the American Academy of Allergy, Asthma, and Immunology, including a role as current chair of the Health, Equity, Technology, and Quality Interest Section, and is the immediate past chair of the Quality Adherence and Outcomes Committee. In addition, in 2016, she was named an AAAAI Choosing Wisely Champion, which I can't wait to ask about in a little bit here. With that, Dr. Sokol, thank you so much for taking the time to join us, and welcome to the podcast.
Thank you, Dave. I really appreciate you and the AAAAI for including me on this podcast. I'm excited to chat with you today.
Yeah, me too. And before we get into the topic at hand, I always like to begin by learning a bit more about new guests, especially about your background. And yours particularly is pretty unique in that you've practiced in both the academic and community-based settings, which I think is going to be invaluable for today's conversation. Can you just tell us a little bit about your career path up to this point?
Sure, no problem. So I graduated from pediatric residency in 2012 and then graduated from allergy immunology fellowship in 2014, both in Texas. During that time, I really enjoyed learning from and working with my research mentors. So I immediately joined an allergy department at an academic setting down in Texas. And I remained in academic allergy for about 4.5 years in various settings as we moved around for my husband's medical training. All while treating both adult and pediatric allergy immunology patients and becoming involved in various research projects. However, in 2019, I realized that I wanted even more interaction with patients in a more fast-paced environment. So I moved to a small but busy private practice in the DC area, like you said, called Schreiber Allergy. Soon after joining, we started a dedicated food allergy center for more intensive management of patients with food allergies. Of course, I see a variety of pediatric and adult allergic and immunologic conditions, but I do really have a soft spot for food allergy. I believe we can truly provide these patients with life-changing management. I'd say that's the majority of my practice, but I see everything.
Oh, that's great. And so in your experience, you've worked firsthand in the community-based setting, private practice versus academic setting. And you've seen the differences in how allergy is practiced in these settings. Can you offer some comments on the major differences that you sort of see in these settings and maybe some insight into why that is?
Well, I have to say, I'm truly lucky that I was able to start my career as an academic allergist, especially right out of fellowship. I think academic medicine really allows for collaboration with other experts in our field, right? And then as well as specialists outside of allergy. Academic allergy really afforded me time to dig deep into certain topics of interest. I really learned so much during those times. I think the biggest difference I've found between academic and community practice is how the majority of my time is really spent. I mean, the majority of my time is spent directly with patients during the course of the day. I'm entirely focused on patient care and patients' immediate needs. The volume of patients is obviously much larger, I feel, in my experience in private practice. Another difference, for better or worse, is the customer service aspect. I think in an academic setting, from my experience, the patients are coming to you because they really think that you're the absolute expert in that topic or that condition. And in private practice, I notice more of like a customer service aspect. So in addition to providing your medical expertise, the patients are coming to you with a lot more questioning, right? A lot more searches on Google and talking to family members. So I don't know, there's good and bad to both, right? But I found that in private practice, from my experience, I formed more lasting relationships, especially with my pediatric patients versus academic medicine, where I might have only seen someone once or twice. I see patients over the past 5 years that I've been there and really get to know them and their families.
Yeah, well, that's really interesting. I appreciate you sharing that. Now, you also have even more of an interesting background because you found the time to get master's degrees, not just one, but two, in biomedical ethics and then public health. What led you to devote all that time to that extra education? And then also, if you can just comment, what are some of the ways that you employ those advanced degrees in your clinical practice and or career?
Clearly, I have a problem. I keep I don't know. I don't know what my problem is. I like to learn, I guess. Well, prior to medical school, I received my master's in public health.
Mm,
And at that time, I was quite interested in preventative care, especially in pediatrics. I knew I wanted to go into pediatrics. So, tackling some of the big issues like pediatric obesity and maternal mental health were attractive to me, as I knew I wanted to become a pediatric specialist. To this day, I think I still use the knowledge I gained through that program to identify ways to help patients early on before disease even
mm,
starts. I think that's one big takeaway I took from my public health training. And then while in medical school, after second year of medical school, I became interested in ethics as I constantly was witnessing situations both in clinical medicine and in research situations that required an ethical perspective. So during my training in bioethics, I was actually able to participate in an ethics consultation service at a large academic hospital. So I gained a lot of real world experience. But honestly, after my 2-year program, I learned that a lot of medical ethics is simply just listening, right? Listening to
hmm
patients, listening to other providers, listening to different sides of the story, and then participating in shared decision making. So I use these tools in everyday practice.
This may be a tough question to answer, but you clearly stand out for many reasons, as many of our wonderful guests do. Do you notice an inherent difference in yourself compared to some of your colleagues, whether in practice now or in the prior academic setting, just in how you communicate with each other or with patients? Like, I imagine you see the world through different lenses. I guess is what I'm getting at, but is that something that you sort of recognize as well?
I mean, I think so. I would like to think so. I mean, soon after I had my ethics training, I was like, kind of like a light bulb, like, oh,
Mm.
doctors don't all talk like this to their patients, right? They don't all sit down with their patients and have conversations about real world things, about different treatments, about different diagnoses, right? Like, not all doctors use their patients as part of that conversation. So that was interesting to me. And I like to think that, we all should be doing that, right? But I like to think that I communicate well.
Okay. Well, speaking of things that we all should be doing, the Choosing Wisely campaign was sunsetted recently, and they transitioned into what I love. It's such a less subtly named "Things We Do for No Reason" series. So, can you tell us about why these campaigns developed and what they were designed to address?
Yeah, this is super interesting. So, choosing wisely, what it was initially called, was actually born out of a concern for cost, right? So,
Mm,
in 2010, a New England Journal of Medicine article was published entitled Medicine's Ethical Responsibility for Healthcare Reform, the Top Five List. And this was authored by Dr. Howard Brody. He's a family physician, but also trained in medical ethics. Um, and that article stated that nearly one third of our healthcare costs could be saved without depriving any patient of beneficial care if physicians in higher cost regions ordered tests and treatments similar to physicians in lower cost regions. So, this article went on to state that US physicians could help control costs if they were willing to practice more in accordance with evidence based guidelines and to study more seriously the data on regional practice variations. So from this, in 2010, Dr. Howard Brody called on medical societies to identify 5 overused tests or treatments in their specialties. And then the National Physicians Alliance, through the American Board of Internal Medicine Foundation, piloted developing these lists for internal medicine and family practice and then pediatrics. And then it called on certain subspecialties. So in 2012, the American Board of Internal Medicine Foundation joined with a bunch of physician societies to announce these clinical recommendations that discouraged unnecessary care. So, Dr. Howard Brody proposed that each society make this list of diagnostic tests or procedures or treatments that, number one, are commonly ordered, number two, are expensive, and number three, have minimal or no meaningful benefit. So the Quad was one of the first of 9 medical organizations involved in the first round of developing these lists of five things physicians and patients should question. And then we continued participation and increased the list to 10 things physicians and
mhm.
patients should question. And That was published in 2014. So at its core, Choosing Wisely sought to advance a national dialogue on avoiding wasteful and unnecessary medical tests, treatments, and procedures. And the thought was this could be accomplished by generating conversations between providers and patients based on these evidence-based recommendations contained in the lists. Um, so yeah, I know you're very involved with the Choosing Wisely campaign, and you've been, so you've been publishing on that as well.
Oh, I love it. I would often print it out and hand it to patients, and it's so well done. It's colorful. It cuts to the point. It has all the references available. And yes, I am a firm believer, but I'm not a champion. I mean, you were named a Choosing Wisely champion. I don't have a cape or a big championship belt. How does one become a Choosing Wisely champion, such as yourself?
So when it was first introduced, the focus of the Choosing Wisely champions was to recognize just individuals who have taken those recommendations and then move them forward, whether through change in practice or engaging in research or writing about the impact. So I would argue, Dave, that you are a Choosing Wisely champion as well. But in fellowship, I was concerned with the necessity and cost of medical treatments. I was looking into Choosing Wisely, and I noticed that specifically in my fellowship, many adult patients I was seeing in clinic were diagnosed with asthma by a primary care physician or other specialist, but had never had any objective testing done. So one of the Choosing Wisely recommendations is don't diagnose or manage asthma without spirometry.
Mm.
And so at that time, when I was in fellowship, there were no population-based studies in the US that had evaluated the utilization of spirometry in newly diagnosed adults with asthma. So I started a large database search during my fellowship, and that's kind of got how I got started in the with the Choosing Wisely campaign, and how I got recognized as a Choosing Wisely champion, if you will. Um,
That's great. I don't have much, FOMO or fear of missing out, but I'll be honest, I'm a little jealous. I'm gonna have perhaps, now that I'm an honorary champion, I'll see if my daughter can come up with like a nice plaque or something that I can hang in the office. So thank you for that. So you mentioned the spirometry. Is that your personal favorite from the Allergy Immunology Choosing Wisely campaign, or do you have another one?
so my personal favorite, for better or worse, I think is, the don't diagnose food allergy with panels of IgE testing. Honestly, I think, for worse, it's because it's a frustrating one to tackle, right? Because we all, as allergists, we all see patients, both pediatric and adult, who come in for an evaluation of food allergy, but their symptoms are not necessarily consistent with true immune-mediated food allergy, but rather, food intolerance, an adverse food reaction, or another GI condition. So I spend a lot of these visits with these patients discussing why specific IgE testing, either via skin prick or blood testing, is unnecessary. And actually, two Choosing Wisely recommendations kind of focus on this. One is don't
Mhm.
perform unproven diagnostic tests such as IgG testing or an indiscriminate battery of IgE testing in the evaluation of any allergy. And then don't perform food specific IgE testing without a history consistent with potential IgE mediated food allergy. So I would say those are my favorites just because I deal with them so much. I'm sure you do
Mhm.
too. Yeah.
Yeah, I share it, and I often get very dramatic and have fun with it. I say, look, this is literally, it's number one on the list of things we should not be doing. It's the worst of the worst things that we should be doing. Like, don't do it. Don't order food allergy panels. So
Right.
I couldn't agree
Right.
more. All right,
Right.
well, let's transition to kind of the topic at hand.
Yeah.
You've been very involved in the what is now the HETQ intersection, and as I mentioned, just rotated off as chair of the Quality Adherence and Outcomes Committee. Can you give us a peek behind the curtains as to what happens in these groups?
Sure. So, as many of you probably already know, there are 8 large intersections of the Quad AI, and HETQ is one of the intersections. It stands for Health, Equity, Technology, and Quality. This intersection is a bit different than others because it doesn't focus on a specific disease state. So, for example, ADVA, that intersection stands for anaphylaxis, dermatology, and drug allergy, or ADT, which stands for asthma diagnosis and treatment. It's a little bit different in that way. And HETQ and each intersection is the home, if you will, to several subcommittees. Um, and we, in the HETQ intersection, we have about 5 committees. Each intersection has a chair, a vice chair, and a secretary, and we are all involved in the planning of the annual meeting. So we spend a lot of time vetting the proposals and the abstracts that come in under our specific intersection. And then we work with the committee chairs closely for each committee that is housed under our intersection to determine the most important and really the most needed sessions to program for our annual meeting. And then, of course, as leadership, we're always looking for members of the Quad AI to become more involved in those committees and with projects involving those committees.
There's a lot
Uh,
of work that goes on behind the scenes. Yeah, sorry, go ahead.
no. I was just going to say the QAO specific committee, which is
Mm.
housed under HETQ, that stands for Quality, Adherence, and Outcomes, has really worked on bringing more attention to the importance of quality improvement into our specialty. So
Yeah, and I always love to ask our guests, many of whom volunteer so much of their time to our organizations, what they find most rewarding while being involved in committees and work groups and things like that. So, would you mind sharing why do you keep staying involved and getting even more involved as you move along your career?
Um, I think this answer is going to be different for a lot of our members, right? I think for me, obviously, I love to learn, as my background implies. But after leaving academic medicine, I found it very important to stay connected to the members
Mm.
of our major national societies. I think by volunteering my time, I'm really able to stay connected to what's going on in our specialty, continue learning from other experts in our field to find out what's going on in our specialty in real time. And then I find it rewarding to be able to bring awareness of our specialty to others. So I'll do a lot of teaching to other specialties, and I learn a lot from just being a member and being involved and volunteering in leadership. Lastly, I think I find it really rewarding to be able to mentor young allergists
Mm.
in many aspects of our field, including career development. So that's part of my volunteerism as well in these societies.
That's a great message, and that's a unique one. We haven't heard that before, and I think it's so important for our members who are in private practice or predominantly private practice, especially fellows in training who are just coming out in the first few years. That's a great way to stay involved in our specialty or to get more involved. Even is to spend time on committees and volunteer through our organization. So I really appreciate you sharing that.
Yeah, of course.
Now, if somebody, let's say, for instance, like the host of a podcast that you're a guest on, like right now, asked you to describe quality improvement methodology and say, we'll give you 2 minutes or less, how would you answer that?
So I think first you have to define QI, right? If you're going to talk about the methodology. So what is QI? Quality improvement is a systematic approach to identifying and solving problems. So simply, it's the framework used to systematically improve care. So the methodology involves starting with a problem. You identify a problem, you identify if there are any national benchmarks or professional guidelines around this problem, and ask yourself kind of what is currently known about the problem. And then next, what can you measure? So you need to choose measurable results and look for existing reports that can be used to establish a baseline for your measures. And next, ask why your problem is relevant. So is it
Mhm.
common in multiple healthcare settings? Are there financial incentives to make this problem better? The external impact of this project should really be evident and not just applicable to your own healthcare setting. And then lastly, using QI tools to carry out your project. So acceptable methodology for QI projects generally involves a framework consisting of multiple cycles of testing interventions or changes over time.
That's pretty good. That was definitely under 2 minutes. All right, you were up to the challenge. So let's dive into a couple of those elements. So tell us about the what goes into formulating a quality improvement goal or outcome measure.
So, quality measures can be determined by the nature of the problem that you're questioning, and then your desired goal for improvement. So, the project should really focus on at least one of the six domains of quality. Safety. So, the six domains are safety, timeless, equity, efficiency, effectiveness, and then patient centered care. And quality measures are defined by the United States Centers for Medicare and Medicaid Services, the CMS. And really, the definition of a quality measure is a tool that helps us measure or quantify healthcare processes, outcomes, patient perceptions, and organizational structure and/or systems that are associated with the ability to provide high-quality healthcare and/or relate to one or more quality goals for healthcare. The measures that are usually the most pertinent, especially for us, are the patient's health status. So that's the most important
Mm-hmm.
outcome measure that I think a lot of allergists would focus on, or a lot of just providers in general would focus on with their QI projects.
Hmm. And something we struggle with at our institution would be timely access to good data surrounding
Mhm.
quality improvement. So can you speak a bit about why data are so important and how they can be utilized in quality improvement?
Sure. So obviously data collection in and of itself is of little use unless it feeds into a robust improvement plan. So, a practice or an institution can use patient level data to identify patients who may benefit from change you're working on, monitor progress, make adjustments when needed, and then track health outcomes, and then obviously lower the cost of care too. So, that's a goal.
Okay. You mentioned before about these cycles of change and things like that, and one of the acronyms is PDSA. Can you tell us what PDSA cycles are and how they should be incorporated into quality improvement projects?
Yeah, so PDSA is a tool that we can use, and there's lots of information on the web about this, and I'll talk about those resources in a little bit. But PDSA stands for Plan, Do, Study, Act. It's a tool used in QI that helps teams assess whether a change leads to improvement or has led to improvement. So the plan part of PDSA cycle is to state your objective, ask questions, state predictions, and then plan to carry out the cycle and plan for data collection. Do is actually carrying out your plan, documenting your problems and unexpected observations, beginning your analysis of your data. And then study is completing your analysis of the data, comparing your data to predictions and summarizing what was learned. And then lastly, act is, what changes are to be made from this and what happens next. So the PDSA cycle is supposed to supposed to evaluate one intervention at a time, and then the results from each cycle can be incorporated into the next intervention. So the PDSA process, it's like a cycle. It can be repeated and repeated until your desired goal is achieved.
Okay. Can you have multiple PDSAs going on at the same time for the same QI goal or outcome measure?
You should have one PDA process to make it more streamlined.
Yeah, yeah, it's kind of focus your attention. Yeah.
Yeah,
And then
yeah.
how long do QI projects typically last for? Like if somebody meets their goal after the first data cycle, does that mean they get to put a little check mark in and move on to the next thing, or do we need to keep going?
Well, I think honestly, it depends on the problem that you're,
Mm,
questioning, right? So I think some QI projects can last a few weeks. Some can be really indefinite. If after your QI project, you've determined your plan resulted in success, you can standardize that improvement and then begin to use it regularly. But after some time, you should always return to that stage one of the PDSA cycle, plan and re-examine the process to learn where it can be further improved. But then if you believe like a different approach would be more successful, you can again return to stage one, the plan, and develop new and different plans that might result in success. So as we discussed earlier, PDSA cycles are ongoing. So you become more efficient as you intuitively adopt PDSA into planning.
hmm I always like looking back and seeing the evolution for specific QI projects about, oh, this is what we thought was going to be helpful at the first stage, and then we realized that had nothing to do with what we were trying to achieve, and here's where we got to where we are,
Exactly.
and yeah, kind of dissecting it. Well,
Exactly.
what about you? Do you employ quality improvement in your own practice? And if so, can you give us some examples?
Yeah, so when after my project in fellowship and when I was an academic allergist at Beth Israel in Boston, I adopted this spirometry project into my practice and our affiliated hospitals. So when an asthma and then I've adopted it even in my private practice now. So when a patient has an asthma diagnosis, it triggers a pop-up on the EMR. So it has info on like guidelines for spirometry and diagnosis and management of asthma, and then it triggers actually a referral to our clinic. So we get a lot of referrals
Mm,
this way. And then we're currently trying to do the same thing with delabeling penicillin allergy. So if a patient at our affiliated hospital is labeled as penicillin allergic, they'll be automatically referred to our office for further evaluation and testing. Now, of course, not all those patients end up in our office, but a lot do. So we're delabeling a lot of patients that would otherwise not have that available to them. Um, Lastly, just QI by partnering with local pediatricians and other practices who are big referral bases for us. We host lunches and discussions on topics such as, why not to order IgE food panels and chronic urticaria screening. And we do lunches on penicillin delabeling. So in and of itself, that's a QI project, right? Because you can
mm.
measure what's being done before and after those discussions.
Oh, I think that's great. Do you have any advice for practices that are interested in implementing QI but really don't know where to begin?
Yes, totally. It's not hard. So choose a topic or a problem you're passionate about. Is it penicillin delabeling? Is it the IgE panels for food testing? Right? And none of this has to be brand new, right? See what other institutions, see what other practices are doing. Look at examples on our website, which I'm going to talk about in a second, and then start collaborating, right? It's difficult to tackle a problem alone. And then keep it simple. That's another really good piece of advice. There are many QI opportunities, and there are many resources available online to help you get started. So, just to name a few, the Institute for Healthcare Improvement, the IHI, they have they have a QI Essentials toolkit, which includes tools and templates you need to launch and manage a successful QI project. And then each of those 9 tools in the toolkit includes like a description, instructions, an example, and it also has blank templates to use as well. So that's really helpful. The next resource that's available online is the Agency for Healthcare Research and Quality, or the AHRQ, and you can find lots of information on this website, but specifically about measures of healthcare quality. And there's also some information on this website on like how to utilize your data. Squire is another resource, SQUIRE. It stands for Standards for Quality Improvement and Reporting Excellence. And this group has published guidelines which provide frameworks for reporting new knowledge about how to improve healthcare. And then lastly, the Quality Corner on the AAAAI website. So if you click on the continuing medical education on the main members website, you'll be taken to a different educational website. And there, like if you scroll all the way to the bottom of the CME website, at the bottom is an icon that says the Quality Corner. So you can click there to be taken to a site that has a ton of QI treasures, including tools and worksheets and questionnaires to help get QI projects started.
If I may, let's come back to that in a second, because I want to hear more about the quality corner. But I have 2 more questions related to QI, if that's okay.
Yeah, yeah, of
So
course.
you gave us a great sort of pitch for those practices that want to do it but don't quite know where to begin. And like you said, there's tons of resources out there, and it's fun if you get the whole team involved and come up with goals, and you see that you're moving the needle and making a difference. But what about our colleagues or practices who really don't think that QI has any value for them? Do you have a pitch that you routinely offer?
Yeah. So, I mean, if colleagues or practices don't think QI can offer them anything or has no value for them, I offer this, right? Allergy immunology is ripe for QI opportunities. It not only improves patient outcomes, but can in turn advance a multidisciplinary approach. Um, you can collaborate with other specialties, other offices, other institutions, and then also increase your own referral base.
Yeah, I agree. I think it's so valuable in so many reasons, and it really doesn't take much to get going, and you just
Right.
kind of build upon it over time.
Right.
One last question, and I think this is one that it's been a point of confusion in my experience with a lot of individuals. People they tend to get confused between what constitutes research versus quality improvement. I think we're all well versed on research methodology, whether conducting it ourselves during our training or reading, research studies and things like that. So, what are some important differences between research and QI?
So research is a systematic investigation, right? Designed to develop or contribute to general knowledge. Whereas QI projects use data-driven methods to improve healthcare delivery and quality. So QI projects examine changes in behavior and are largely an experiential learning process.
Yeah, well, wow, that you cut right to the chase. That's fantastic. Yeah, I always like to. I see our fellows often struggle with this over the years,
Yeah. Yeah.
and they get to the point of like with QI, almost like, well, we did so many different interventions. How do we know which one was really the one? Or and I say, I don't care. That's the beauty of
Yeah.
QI. If we meet
Yeah.
our goal, with
Right.
research, you want to control for everything except for one variable. In QI, it's everything's on the table. So yeah, I love it. Well, let's go back to this quality corner that you mentioned, which is on the Academy's website, and you mentioned some of the tools. Give
Mhm.
us a little more background about how can listeners sort of navigate these tools and implement them in practice and kind of go from there?
Yeah, so like I said, the quality corner is there on the Quad AI website for you. It's probably underutilized, right? But if you look there, get like I said, you get lots of QI treasures. So you can some of these tools that we've been talking about, like the PDSA cycles, right? They're on that website. So you can download them, you can use them, you can use templates. There's worksheets available to go through your planning process. There's questionnaires that you can use to help get a QI project started. And then there's a quality showcase actually on that quality corner where it has it's a place on that website where members, or really any non-members, can upload their QI work in the space of allergy immunology, so you can see what other people are doing. And I think, again, this is very underutilized, and I think if people can put their QI projects in, no matter how big or small they are, right, that can give us an idea of what's being done in our specialty and where we can collaborate with each other, and how we can really work together to fix these problems that we've been talking about.
I love that you put a plug in for the quality showcase, and that goes back to something you mentioned just a few minutes ago of nobody needs to reinvent the wheel. If you're
Right.
looking for ideas or how others have done this, go to the quality showcase, see the projects that are submitted by our colleagues through the academy, and you can see what kind of work they've done. As you mentioned, there's been a lot of penicillin allergy delabeling projects
Mhm.
over the last few years, which is great. But there's other work on asthma and things like that
Yeah.
as well.
Yeah, and just because other people are focusing on penicillin delabeling doesn't mean you can't either, right? Because every institution can do this.
Mhm.
I think it's extremely helpful to be able to see what other allergists are focusing on for their QI projects across the country. We often see these same problems pop up time and time again. We are a small specialty, right? So we need to work together.
Yeah, when we implemented a hospital-wide penicillin allergy delabeling process at our institution, which I was the lead on, oh my gosh, 8 years ago, I stole everything that Kim Blumenthal and her colleagues did at Mass General. I mean, they published it.
Right,
They
right,
gave us the blueprint. I said, "This is
right,
published. Let's do
right.
this."
There's your template. Yep,
Yeah, and
exactly.
there's
Yeah.
multiple iterations since then. Yeah. You alluded earlier about some of the work that goes on in the intersection and the committees about providing programming through the academy's annual meeting. Oftentimes, these sessions, of course, are going to address quality or outcomes in various ways. Can you give us some examples from the recent 2024 annual meeting, particularly any sessions that attendees may want to watch the recordings of?
Yeah. So during the 2024 annual meeting, we revised a concept that we had presented in 2023. And we presented a symposium entitled Incorporating Quality Improvement into Allergy Immunology Education to Improve Skills and Experience. So I was the moderator, and this was a group of experts, right, that discussed barriers to QI, strategies for institutions and individuals. And then we highlighted real world examples of past and ongoing QI projects. And this specific symposium is available on demand if you go to the annual meeting website. During the 2023 annual meeting, I was a moderator for the first QI session that we proposed. It was like basically how to build a QI project from the ground up. And these ideas are coming directly out of the QAO committee and its committee members' ideas. So, if you guys have any ideas, right, for QI symposiums, seminars, courses, anything, all you have to do is become involved, and we can talk about these proposals.
Yeah, and it's a great way. People can nominate themselves to speak,
Right.
right?
Yeah.
Yeah. So if this comes through the committee, work with your committee leadership to help formulate a good suggestion for a topic and symposium, and then put it in. And this is you never know where that can lead to things. So I agree with you 100%. Do we miss anything? Are there other academy resources along this realm of quality or outcomes that we should direct listeners towards? Is this? I don't know if you want to talk about MIPS or anything like that, but
Um, no,
you don't
not
have
right
to. You
now.
don't have to.
No, I think honestly the best resource is just first step is getting involved, right? So either getting involved in committees, that's a great first step, either in person or at the annual meeting, or online via committee communications. If you're interested in getting involved in committees and don't know how, just reach out to leadership. You can also identify your interests online in the members section. Like I said, email leadership. Get just even being on the committee shows your interest, and then we can get you involved thereafter.
Throughout your career, you've demonstrated you clearly have devoted yourself towards addressing gaps in the quality of care that's provided to our patients across various settings, and you spend so much time educating others about them as well. Your passion for this comes through, but can you tell us why this is so important to you?
Well, my career as a physician has not been a long one yet, but clearly, my background has taken me on a path towards improving quality of patient care, or wanting to improve quality of patient care. I think it is essential to address gaps in the quality of care provided to patients and educate others about them to really uphold the principles, right, of fairness, improve health outcomes, and then build trust within healthcare systems. And my background thus far has kind of taken me here. And I try to incorporate this into my daily practice.
Well, I think that's great. Um, as we wrap up, if you're okay with it, can I ask some rapid fire, like more personal questions to help our listeners get to know you better?
Sure. Uh-oh.
This is always a fun part, and you've already established yourself as a leader in our specialty, and you're clearly very involved and not going away anytime soon. So I think this will be fun, and then hopefully we'll have you back at some point and we can build upon it. All right, I promise these will be harmless. Okay, which do you tend to crave more, salty or sweet?
Oh, definitely salty. French fries specifically.
Ooh, okay, I have it. Yeah. Now, any particular cut, like a waffle fry or?
Mm. Straight and crispy.
Okay, all right. What is your ideal vacation? Sitting on a beach, hiking through nature, or visiting a bustling city?
Hard one because all are awesome. It depends on the time of year too, right? But I have to say kind of a mix of sitting on a beach and then culture. So the last 2 big vacations we've taken our kids on, we've gone to Costa Rica and Belize, both kind of similar, like a mix of beach and jungle and also lots of culture.
All right, I like it. Do you have a book that you most frequently recommend or gift to others? And if so, what is it and why?
So there is a book of quotes and life lessons and beautiful illustrations. I don't know if you've ever heard of it called The Boy, the Mole, and the Fox and the Horse. Have
Oh,
you heard of this?
yes. Yes.
Yes. I always recommend that to new parents, also seasoned parents. It's so cute. I have some of the quotes like printed out and I go back to that all the time with my kids.
Why is it meaningful to you? Does it just resonate with your journey as a parent, or are there other reasons?
Yeah, it resonates with my journey as a parent, teaches such important universal lessons, and the illustrations can't be beat. So just looking at them is so beautiful.
Okay, I appreciate you sharing that. All right, one last one. If you could push a single text message to every practicing allergist right now, as soon as we're done here, you push it and you send it, what would that text say and why?
Um, get involved, advocate for our specialty and our patients.
Wow. We end on an inspirational note. Well, Dr. Sokol, thank you so much for taking the time out of your schedule to join us. I think this has been great, and hopefully we get folks to visit the Quality Corner, submit their QI projects to the showcase, and get more involved in quality improvement, and also the Academy. Is there anything else you'd like to add?
No, thank you so much to the Quad AI and to you, Dave, for having me. This has been so fun.
Well, it's our pleasure. Thank you again. We hope you enjoyed listening to today's episode. Please visit www.AAAAI.org for show notes and any pertinent links from today's conversation. If you like the show, please take a moment to subscribe to our podcast through Apple Podcasts, Amazon, iHeartRadio, or Spotify so you can receive new episodes in the future. Thank you again for listening.